Welcome to the State Industrial Products Training Series, Bloodborne Pathogen Training. After you complete this course, you will be able to identify situations where you may become infected with bloodborne pathogens, perform procedures using safe practices that will help prevent infection and exposure, and identify myths surrounding bloodborne pathogens. We will begin by discussing the basics of bloodborne pathogens, including general information on the diseases, how they are transmitted, and potential exposure at work. Then we will discuss the many ways that exposure can be prevented to help minimize your risk. First, the basics. Pathogens are disease-producing bacteria or microorganisms. Specifically, OSHA defines bloodborne pathogens as pathogenic microorganisms present in human blood that can lead to diseases. There are many disease-causing pathogenic microorganisms that are covered by this standard. However, the ones we will cover and those of primary concern are the human immunodeficiency virus, hepatitis B, and hepatitis C. The first pathogen we will discuss is the human immunodeficiency virus, or HIV. HIV is the virus that leads to acquired immunodeficiency syndrome, or AIDS. It is possible for a person to carry HIV for many years and never develop symptoms at all, or not until it turns into full-blown AIDS. AIDS attacks a person's immune system, making it difficult for the body to fight off disease. Scientists and medical authorities agree that HIV does not survive well outside the body. Drying of HIV-infected human blood or other bodily fluids reduces the risk of environmental transmission to essentially zero. HIV is found in very low quantities in saliva and tears from some AIDS patients. However, HIV has not been found in the sweat of HIV-infected persons. It is important to note that contact with saliva, tears, or sweat has never been shown to result in the transmission of HIV. The next pathogen we'll discuss is hepatitis B. This is a virus that chronically affects between 1 and 1.25 million Americans. While hepatitis B can survive in dried blood for at least a week, there has been a vaccination available since 1982 that can prevent contraction of this disease even if exposure occurs. Like hepatitis B, hepatitis C can lead to chronic liver disease. Unfortunately, this virus does not have a vaccination that can prevent infection. An estimated 3.9 million Americans have been infected with hepatitis C, of whom 2.7 million are chronically infected. Persons chronically infected with hepatitis C may not even be aware of it because it can take 2 decades before symptoms are recognized. While there are some drugs that have been licensed for treatment of hepatitis C, they are only effective in 10 to 40% of persons infected. Now that we've discussed specific pathogens, it's necessary to talk about means of transmission. If your facility is a medical hospital or clinic, or a laboratory with human cell cultures, you will have more potential exposure to bodily fluids than a general industrial facility would have. The bodily fluids you are most likely to encounter in the general workplace are blood, saliva, vomit, or urine. If blood is not present in a bodily fluid, bloodborne pathogens cannot be present. Remember, sometimes blood may be present in microscopic quantities and difficult or impossible to see with the naked eye. To be safe, you must always assume that all bodily fluids are contaminated with infectious blood. This is called universal precaution. Bloodborne pathogens can only be transmitted if you physically make contact with an infected person's blood or bodily fluid containing blood. Even then, your healthy skin is an excellent barrier to bloodborne pathogens. If your skin is not intact at the point of contact with the contaminated blood or bodily fluid, the bloodborne pathogen could potentially be transmitted. Examples of non-intact skin include dermatitis, hangnails, cuts, abrasions, acne, etc. Contaminated blood or bodily fluid can also enter your body through mucous membranes such as your eyes, mouth, or nose. Obviously, a contaminated sharp, such as a needle or broken glass, could also potentially transmit bloodborne pathogens because of the penetration of the skin. OSHA's bloodborne pathogen standard requires employers to identify the jobs, tasks, and activities that could expose employees to potentially infected blood or bodily fluids. Generally speaking, exposure could occur when you are near someone who is involved in an industrial accident, when administering first aid to someone who is bleeding, or cleaning up work surfaces, equipment, or machinery after an accident. Additionally, janitorial workers are potentially exposed when cleaning up urine, vomit, sanitary napkins, etc., and maintenance workers might be exposed when repairing the plumbing on a toilet. Knowing the means of transmission and exposure of bloodborne pathogens is the first step to prevent infection. The next step is to take the necessary precautions to minimize the risk of infection. Per OSHA's regulations, all companies are required to have a written ECP, or exposure control plan. It is imperative the ECP is available at all times and employees know where it is located. The goal of the ECP is to identify potential exposure and define work practices for preventing exposure. The ECP addresses many elements, all of which we discuss in this training video. In addition to your right to access the ECP, you also have a right to access the OSHA Bloodborne Pathogen Standard. If you want to have a copy of the actual standard, all you have to do is ask your employer. OSHA defines universal precautions as an approach to infection control. According to the concept of universal precautions, all human blood and certain human bodily fluids are to be treated as known to be infected with HIV, hepatitis B, and other bloodborne pathogens. The appropriate precautionary methods will enable you to avoid contact with infectious material. By avoiding contact, there is no exposure. Thus, we can avoid contracting a bloodborne disease. Universal precautions protect individuals who are directly involved with the cleanup process and who will possibly be in direct contact with the spill of bodily fluids. Always wear appropriate personal protective equipment when handling any type of bodily fluid. Universal precautions also require adequate cleanup and decontamination of yourself, equipment, and tools. Always wash your hands after handling any type of bodily fluid, even when you've been wearing gloves. When it comes to protective equipment, determine what kind your company has available. Is the equipment located in the first aid kits? Many first aid cabinets contain bodily fluid disposal kits that have personal protective equipment such as gloves, masks, aprons, and face shields. The location of available personal protective equipment should be specified in your exposure control plan. Personal protective equipment is a vital part of preventing potential exposure. As all first aid responders know, universal precautions are required, so protect yourself first. For normal bleeding, gloves such as latex are required. Work gloves, rags, plastic, or even paper will work as a barrier if latex gloves are not available. The point is to use something as a barrier between your skin and the victim's blood or bodily fluids. For spurting blood, more than just gloves are required. Protect your mucous membranes such as your eyes, mouth, and nose with a face shield or a mask. Also, wear protective clothing such as an apron, smock, or shoe covers to protect your skin. For post-accident cleanup, generally just gloves are needed to protect your hands when disinfecting surfaces or equipment. As a note, janitorial workers should always wear gloves, particularly when they're cleaning restrooms. An important part of preventing exposure to bloodborne pathogens is proper decontamination and cleanup. As with all bodily fluids, assume contamination and wear protective gloves. Bodily fluid disposal kits should contain fluid cleanup materials such as an absorbent powder, a disinfectant solution, and a disposal bag. The powder can be sprinkled on liquid bodily fluids such as blood. When the powder absorbs the fluid, it can be scooped up and placed in the disposal bag. Wipe down all contaminated surfaces with the disinfectant solution in order to ensure that all bloodborne pathogens are killed. Be sure to follow the label instructions for the particular disinfectant you are using. If only bleach is available, use a 1/4 cup bleach for each gallon of water and allow a 10-minute contact time to sufficiently disinfect the surfaces. Then, dispose of all contaminated gloves, towels, rags, absorbent powder, etc. by placing it all in the disposal bag. There are also common sense, safe work practices that will help prevent exposure. If blood splashes onto your shoes, pants, or shirt, remove those items as soon as possible. Remove contaminated personal protective equipment, such as gloves, as soon as you are done administering first aid or decontaminating equipment or work surfaces. Make sure to thoroughly wash your hands, face, or any other areas of your skin that may have come into contact with bodily fluids, even if it was covered by personal protective equipment. If you believe that blood or other potentially contaminated bodily fluid was splashed into your eyes, immediately go to an emergency eye wash station and flush your eyes. Once you've taken care of your person, cleaning and disinfecting tools, work surfaces, and equipment will prevent the next user from unknowingly coming into contact with potentially infected bodily fluids. Lastly, anything that needs to be disposed of, be sure contaminated items are placed in appropriately labeled bags or containers to help prevent someone from accidentally being exposed. A precaution that can be taken outside the workplace is getting a hepatitis B vaccination. The use of the hepatitis B vaccine is strongly endorsed by medical, scientific, and public health communities as a safe and effective way to prevent disease and death. There is no confirmed evidence that indicates the hepatitis B vaccine can cause chronic illness, and reports of unusual illnesses following a vaccine are most often related to other causes and not the vaccine itself. The hepatitis B vaccination is a series of 3 injections that are effective in preventing infection with hepatitis B. Currently, there is no requirement for routine boosters. However, this is still being assessed and may change in the future. Once you've taken the necessary precautions cleaning up after an accident, you will almost always have to dispose of waste, some of which is medically regulated. Most industrial facilities can handle blood or bodily fluids by simply absorbing any liquids, double bagging the contaminated items, and disposing of them in the dumpster. Be sure to clarify your company's procedures in the written ECP. If your company does have regulated medical waste that requires regulated disposal, your company must contact a medical waste disposal company to set up a program. Refer to the ECP for instructions. Regulated medical waste includes blood or other potentially infected bodily fluids that are in a liquid form. If absorbed liquids can be released when compressed, such as from a sponge, it is also a regulated medical waste. As a rule of thumb, items such as Band-Aids or tissues that we would typically throw in the wastebasket are not regulated medical wastes unless you are a medical facility where the amount of this type of waste is extensive. Otherwise, unless you could literally wring out the blood, it would not be considered regulated medical biowaste. A good rule to follow is, when in doubt, treat it as regulated waste to avoid violating any EPA laws for proper disposal of biohazard wastes. Also make sure that all sharps, including needles and broken glass, go in the appropriate sharps containers to avoid contamination through impalement or laceration. Pathological and microbiological waste containing blood or other potentially infectious material, such as from a medical laboratory, is also another way to prevent potential exposures through communication, which includes appropriate labels and signs. All regulated medical waste must be labeled in accordance with EPA requirements for biohazard waste. If the material is not regulated, such as liquids that are adequately absorbed or Band-Aids, it can be disposed of in an unlabeled bag and discarded in the trash. Refrigerators that contain biohazards should also be labeled so that no food items are placed in those refrigerators. And, of course, any container that may store potentially infectious materials must be adequately labeled as well. If an employee has been exposed, the employee must be offered a post-exposure evaluation. Your company should document this determination of exposure and whether or not the exposed employee accepted the offer of a post-exposure medical evaluation. An exposure incident is a specific incident of contact with potentially infectious bodily fluid. If there was no infiltration of mucous membranes or open skin surfaces, it is not considered an occupational exposure. If an employee administering first aid on normal bleeding is wearing the appropriate gloves, then an exposure incident does not exist. Be sure to report all incidents involving blood or bodily fluid so the company can determine if an exposure occurred and then offer post-exposure medical evaluations if necessary. After each accident, an accident investigation report must be completed. If blood is spilled, documentation of the spill location, who cleaned it up, the cleanup method, and waste disposal location must also be kept. After all is said and done, if you feel you were exposed to bloodborne pathogens, you must report it to your employer. For example, after an industrial accident, determine if any employees were exposed. The post-exposure medical evaluation is designed to help determine if the person was exposed to infected bodily fluids. The medical evaluation is completely confidential for both the exposed person and the source person. Not even the company will know the results of such testing. The evaluation will document the route of exposure and will identify the source individual. If the source individual gives consent, the evaluation includes testing his or her blood. The results of such testing are provided by the medical personnel to both the source individual and the exposed employee. Contact your local occupational health clinic to get more details on exactly what kind of testing would be done for a post-exposure medical evaluation. Today you have learned about bloodborne pathogens and the workplace situations that might expose you to them. Additionally, you've learned necessary precautions to take when administering first aid to help prevent exposure and limit the chances of infection. Now you should effectively be able to protect yourself and help protect others from exposure incidents and infection. Thank you for participating in State Industrial Products.